Does it seem like more people have bipolar disorder now than in the past? That's what I'm talking about today. I'm Dr. Tracey Marks, a psychiatrist, and I make mental health education videos. Today's topic is based on a viewer question from T. T says, is bipolar disorder on the rise? Me, my parent, and 2 siblings all have it. We generally got it in our 20s and 30s. It seems like everyone is getting it, and I don't remember seeing commercials for it in the 1980s when I was growing up. Thanks, T, for your question. My knee-jerk response to T's question was that bipolar disorder may seem more common because mental health in general is more popular to talk about publicly than it was even 10 years ago. But certainly the 80s and 90s predate the internet. With no internet, you had to rely on television, print news, and other traditional forms of information to learn about things. But even after the internet and social media made it easier to disseminate information, mental health was still too taboo to talk about. There was, and still is, fear of being stigmatized or discriminated against. Then came celebrities like Mariah Carey, Bebe Rexha, Demi Lovato, Kurt Cobain, and Mel Gibson, just to name a few, who publicly disclosed their diagnoses and helped start and continue the discussion of mental health. The increased attention to mental illness gave rise to more people seeking help and getting diagnosed, rather than lurking in the shadows and suffering silently or self-medicating with alcohol or drugs. Some people fly under the radar of medical treatment, never get a diagnosis of bipolar disorder, and instead struggle with addictions or end up in the criminal justice system. Another contributor to this perceived increase is there's been a bit of a redesign of the illness as we've come to understand it more. The basic criteria has remained the same, but there's been some tweaking of things, like some people believing in a spectrum illness that allows for more softer signs of bipolar disorder, like being unresponsive to antidepressants or having a rapid relapse of depression symptoms, and that being an early sign that a hypomanic or manic episode may be forthcoming. So these are 2 factors that can increase the number of people being diagnosed with bipolar disorder. The topic becoming more popular and making people seek a diagnosis, or they believe they have it based on a self-diagnosis, and more doctors recognizing softer signs and lowering the bar for what we call bipolar disorder. You can think of these reasons as causing artificial elevations in the prevalence of the disorder. That is, these reasons don't affect how many people actually have bipolar disorder, just how many people get the diagnosis. And the more people who get recognized with it, the more it becomes a topic of conversation both offline and online. That's the easy explanation, but not the end of the story. Some studies suggest that there's a biological reason more people are being diagnosed with it. Epidemiological studies that look at prevalence rates estimate bipolar disorder to exist in about 2 to 4% of the population. That's small compared to unipolar depression that's around 10 to 12%. The peak age of onset is between ages 20 to 30. That's the most common age range. Some people develop prominent symptoms in the adolescent years, and then there's a late onset form that occurs around ages 45 to 55. Some of these prevalence studies are years old, like from the early 2000s, but they still show an upward trend in more people being diagnosed. The answer to why the increase may lie in the risk factors, which are the things that can increase your risk of developing bipolar disorder. Now, we still don't know exactly what causes bipolar disorder, and it's an active research focus. But here are 5 of the factors that have strong evidence for increasing your risk of developing bipolar disorder. Number 1 is obesity. Obesity is defined as having a body mass index of 30 or greater. Overweight is 25 to 29. A 2021 study showed that people with a high body mass index had structural changes to their brains. Mostly, they had larger ventricles, which are the spaces in your brain that contain fluid. If something happens to make your brain shrink in size, your ventricles expand to fill the space. We know from other studies that depression causes shrinking of your hippocampus and other brain structures. So this isn't anything that's entirely new when it comes to brain disorders affecting your brain tissue. What's not explained by these studies is which came first, obesity causing a smaller brain and then bipolar disorder, or bipolar disorder causing obesity. Regardless of which came first, this finding gives us a target for treatment by aggressively managing weight. Number 2 risk factor is cannabis. Several studies have shown an association with early cannabis use and later developing a psychotic illness and now bipolar disorder. How much do you need to use for this to be a real risk? Of course, studies vary, but one study showed that an increased risk from using 2 to 3 times a week. Across most of the studies, at least the ones that I reviewed, frequency was a stronger indicator than absolute amount used. So going to a couple of parties and smoking a lot was not as significant as regularly using an even smaller amount. Number 3 risk factor is certain illnesses like irritable bowel syndrome and asthma. A proposed mechanism of causation is through the secretion of cytokines, which are chemicals that the body uses to stimulate the immune system. Sometimes these inflammatory mediators, they're called, are a good thing. But when they're secreted in excess or at inappropriate times, like attacking your own tissue, it can be a bad thing. And increasingly, the mood disorders like depression and now bipolar disorder are being linked to inflammation as a causative factor and not just an association. Number 4 risk factor is having a first-degree relative with the illness. First degree is someone who shares half of your DNA. This would be a parent, sibling, or child. Having a first-degree relative does not mean that it's a given that you will get the same disorder, but it can increase your risk 13-fold. T said in his question that his parent and 2 siblings all have been diagnosed with bipolar disorder. I do think that's not the typical that all of those people would end up having the same disorder, but this could just be his genetics. What I have seen more in practice is one person having a mental disorder, let's say it's bipolar disorder, and maybe they have a parent with it. Then siblings may have some other problems like anxiety or depression, but not have been treated for bipolar disorder. It's hard to have bipolar 1 disorder and never come to the attention of doctors because mania can be pretty severe and hard to just get over without some kind of intervention. So when a person says to me, I think my 35-year-old sister has it too, but she's never seen a doctor before. Sister probably doesn't have bipolar 1, but she could have bipolar 2 or even ADHD, which can look similar in some ways. And the 5th risk factor, one that you probably wouldn't have guessed, is having been infected with the parasite TOXOPLASMA gondii. The illness that goes along with this infection is called toxoplasmosis. The parasite can live in cats, so the most common way to get infected is coming into contact with cat feces. Other ways that you can get infected is eating contaminated meat that's undercooked, including shellfish like clams and mussels. Or you can pass it to your unborn child if you get infected during pregnancy. So getting back to the original question of, is bipolar disorder on the rise? It's possible that increased cannabis use, increased obesity rates, and an increase of inflammatory-based medical problems that possibly stem from food insensitivities could give rise to increased risk and development of bipolar disorder and other mental disorders. So the answer is our lifestyle and environment can be the cause of an increase in everything, including bipolar disorder. Fortunately, some of these factors are changeable. You can't change your genetics, but you can change your diet, exercise, and smoking habits. If you have a cat, no bare hands in the litter box. Take a look at my nutritional psychiatry playlist. That's a good starting point for how you can make changes to improve your mental health. Thanks for watching. See you next time.